still fighting the storm. Hearts full of pain, but we're trying to transform. Mental health matters, can push it aside. We're more than survivors, we're meant to rise. Give us the care, not just the blame, cause healing begins when you call it by name. Stop the bullying, don't look away. Stop being silent, just speak up today. We're still breathing, fighting the storm and trying to transform. Fighting the storm and trying to transform. Fighting the storm and trying to transform. Fighting the storm and trying to transform.
Welcome back to Making Change Requires Everyone. I am Kerry and I have here today my co-host.
Hi, I'm Torsha. Today we are diving into an incredible important issue, service access to mental health in marginalized communities.
Yes, it indeed is an incredibly important topic because even though mental health awareness has been growing in Canada, not everyone has access to the same level of care. Whether it's due to poverty, race, immigration status, language barrier, geographic location, or more. Here's a troubling statistic. Here in Canada, since the pandemic, 40% of Canadians have faced a decline in their mental health. You can imagine that this decline in mental health may intersect with different aspects of a person's experiences and identity.
Right, Kerry. In fact, I heard Daniel Jocelyn O'Toole, board chair of the Black Healing Center, explained that as you add more layers to the of trauma experienced by those holding intersectional identities, the barriers quadruple. To help shed more light on the topic, we have joining us our guest Sampreet Arneja, co-founder of Scattered Automatic Expression and special educator at Centre Intégré Université de Santé et Services Sociaux, also known as CUS, who has seen first-hand access issues impact communities on the ground. Let's let Sampreet present himself and his profession.
Hi. Thank you for that beautiful introduction. So I'm Sam. I work at the CIUS de l'Ouest de Montréal. I work with people with cognitive disabilities. And so one of my jobs as a special educator is to help reintegrate them into society. And so for each person, we create individualized plans to help with everything from, hygiene issues to getting them to be able to go to work or school. I also co-found a nonprofit organization a couple years back called Scattered Automatic Expression Association, where our goal is to provide mental wellness resources to everyone for free, because we find that a lot of these resources are immensely inaccessible to a lot of people, especially marginalized communities and those in the BIPOC community.
That's incredible. Thanks, Sampreet. I think one of the things that gets overlooked, how complex access really is. It's not just about whether services exist, it's just about whether people feel safe using them. For example, youth in racialized or indigenous community might not trust mental health access because of the historical mistreatment or the current bias. Others might feel not to have culturally competent care or services in their language.
Here's another eye-opener. There's a huge underrepresentation of Black, Indigenous, or other BIPOC practitioners in Canada. That kind of underrepresentation can even make it hard or difficult for youth of color to connect with mental health professionals who understand the cultural context. So what are some of the biggest issues you've seen in your work, and how can communities and governments begin to close that gap?
So one of the biggest issues that I've seen comes from, as you said, like the biases that we have, so especially in BIPOC communities. I myself being Indian, as well as the clients that I've worked with that come from Indigenous backgrounds, or that come from African backgrounds, who the concept of mental health has been so shut off to them for so many years. Right, so conversations about how you feel, or the justification of feeling not too great, a lot of those things get shut down from a young age. So when it's finally at a point where they need to reach out to medical professionals for help, the situation is already so far gone, as opposed to being able to, reach out and accept the help at an earlier stage. the quietness around it, we wait till the last second, and at that point, now we have a system that is packed with constantly trying to help and support crisis as opposed to prevent that crisis in the first place, prevent the mental health issues from breaking out. And who are the most affected by this? The people in the marginalized communities that already have low access to, mental wellness education in general.
Thank you for your answer. It's clear that we need more. We need more than just services. We need better services, especially those designed with equity in mind. We also can't forget the economic barriers. Even when these services exist, they're not always affordable, and waitlists for low cost or free services can be months or even years long, especially in low income or rural communities. In some areas, youth can wait up to 12 months for services, particularly in low income or rural communities. That's way too long for someone in crisis that could be a danger to themselves or others.
Exactly, and we need to remember that access isn't just about treatment, it's also about prevention, education, and safe environments for young people feel they matter and can ask for help. Thankfully, there are some organizations that are truly making an impact, including Black Mental Health Connection and Black Healing Center and Justice Autistique here in Montreal, and SOCH Mental Health, which offer culturally competent resources for South Asian community in Brampton. So, for our final question in this segment, what are some practical, immediate steps we can take as individuals, communities, and policymakers to make mental health care more accessible, more inclusive, and more equitable for everyone?
I'd say one of the biggest things that we can do is let's change the conversation, right? So I'll give you a little example of the reason why we started Scattered. So we began Scattered Automatic Expression Association because I began seeing a change in the cultural climate where I saw people were posting, infographics on how to better your mental wellness on TikTok and YouTube and doing that for views and clicks. And what started happening is that people that didn't have a lot of mental illnesses started developing symptoms of those mental illnesses. And the reason for that is because what they were seeing on their phone, they started believing that they had, right? So we wanted to create something that would allow people who have no access to gain that access and to be able to do the self-reflection within themselves. So one of the big principles that we follow by is no one can tell you how you feel better than yourself, right? So in these communities that we've began running workshops like this, it's opened up dialogue, not only within themselves, but people who would typically never express themselves in any specific way now started having conversations with their parents about how they feel and about how, their life can be. And so I think this is kind of the main way that we can change this as a society, whether you're a fellow listener, whether you are a community activist, whether you work in politics. I think changing the narrative around mental health from being a crisis-oriented situation to something that everybody can benefit from, and something just as important as our physical health, right? We go to the gym, we don't just go to the doctor when something's wrong. We work on it throughout. So I think changing that conversation in our communities, in our homes, in our schools, and educating everyone on what mental wellness truly is a big step forward.
Thank you again for that answer. Your insight and lived experience have been invaluable, and we hope our listeners take away something powerful from this conversation.
And to our listeners, if you or someone you know is struggling with mental health, please know that support exists. It might not be easy to find, but you are never alone.
That wraps up this segment of Making Change Requires Everyone. All Canadians deserve equal opportunities to thrive, no matter their origin, culture, religion, socioeconomic status, language, or skin color. We hope this discussion encourages real change because because access to mental health care should never depend on where you live, what you look like, or how much money you have. All of us in Canada deserve a high quality of life, regardless of our culture or our skin color.